Dr. Wilson, would you like to come up and do your presentation?
Well, good morning, everyone. I feel sort of like Elizabeth Taylor's sixth husband. You know, it's going to be difficult to make things interesting after all of this excitement. Well, I'm somewhat new to Florida. We moved here in January from Nebraska, which is in the United States of America. It's in the center. It was 5 degrees and snowing when the North American van line pulled out, and we've adjusted pretty well. Got through a hurricane. It's been fun. This is sort of a modern depiction of Nebraska. My great uncle Kit Carson is there on the right. Now, the hurricane was interesting, but growing up in the Midwest, we had these sorts of things every summer. This is actually the tornado that destroyed 40% of my hometown the year that my wife and I got married. We're from the same little town, and we like to say the tornado was the second biggest blowout of the summer after our wedding reception. That was quite a thing. The tornado is actually about 5 miles away. It was a half-mile wide at the base and 60,000 feet tall. It was quite remarkable. Anyway, here to talk about the University of Florida component of UF and Shands in Jacksonville. I think in some respects, Yank and others have described us as one of the better kept secrets in the city. And I was very impressed upon visiting the facilities, first class. The competence of the staff is impressive. The dedication of the physicians is remarkable. Having moved here, when some people have asked, what I do, and I said, well, I'm the new dean of the College of Medicine, UF College of Medicine. And occasionally people say, well, why are you living here? Why aren't you in Gainesville? People, I don't think, fully appreciate the scope of university operations here. In part, the media depicts the Shands Hospital as the locus of care for trauma or significant news stories that might emanate. So a big part of my job, I think, is going to be to help the city, region, and state fully appreciate what we have and where it can lead in the future in terms of not only clinical care but bioscientific research. So I'll run through a quick overview of our campus and activity. We have actually around 400 faculty members, 400 University of Florida physicians who are on faculty living in Jacksonville. I don't think people fully appreciate that. We actually have 330 residents. 270 or so are funded through Medicare, the conventional mechanism, but the hospital funds another 60 resident slots per year. So basically 700 plus physicians working for the University of Florida in Jacksonville, on the order of well above $200 million in revenue. And I would quickly point out that per physician, our activity and productivity outstrips what we sometimes affectionately call the rural campus in Gainesville, our colleagues there. It is a confusing, complicated relationship, UF and Shands in 2 sites, the main campus with the total university and then a large health science center, and then the Shands Health System. But we're symbiotic, we're distinct corporate entities, but sort of are Siamese twins. This is a point about our overall impact. For every dollar of state funding, of which we get very little here in Jacksonville, by the way, we return over $6 to the state in economic activity. The College of Medicine in Jacksonville has revenue equal to all the other health science colleges in Gainesville, apart from the medical school, veterinary medicine, dentistry, pharmacy, and so on. So it's a big enterprise. Well, our mission In terms of education, all the UF students rotate through here, but it's not the primary site for basic sciences in particular, which are in Gainesville. We still have direct ties for medical student education through the dean's office in Gainesville, but otherwise we're entirely parallel and administratively separate. The campus serves the total pharmacy education for 200 students in Jacksonville. I suspect not very many people realize we have a School of Pharmacy in Jacksonville that educates 200 people. And the site as well for a substantial nursing program, especially in advanced practice nursing. I'm sorry these slides have come out a little misconfigured on the screen here. It's grown a lot from 600 student weeks in the late 80s to over 3,000, so an expansion of 5 to 6 times. 25% of the students are required to be here in the third year for specific rotations, and all third and fourth year students do come through. We would like to have a cadre, a cohort for third and fourth year who are in Jacksonville full-time, and then others who come for electives. It's just sort of another summary, a lot of CME. We have a very substantial Center for Stimulation, Education, and Safety Research that is a critical path for health education in the future, and the Borland Health Sciences Library on campus. CME has grown, GME has grown a lot, graduate medical education. We have a total of more than 30 different programs, fellowships and residencies, and 2 were established this year in anesthesia and psychiatry. And we have others in the wings, depending on finances, frankly, and a key one would be reestablishing our family medicine residency, hopefully when we build the North Campus project. Research is very significant for a freestanding, a clinical campus without basic science. 26 million in external funding last year, something like a 30+% increase in the University of Florida in Jacksonville. More than 600 studies currently. We have a specialized research unit and a lot of growing research in health equity and quality research, as well as community engagement. The first level 1, in terms of clinical services, the first level 1 trauma center, Jim Burkhart mentioned practice sites, actually 64 across the city and even North Florida and the state. We have a $200 million proton therapy unit for cancer, one of the most advanced in the world. Regional perinatal services, Center for Autism and Related Disabilities, work closely with Wolfson and Nemours in pediatrics, but we also do the child protection team. Primary Stroke Center, state-designated brain and spinal cord unit, and 600+ licensed beds, which we're going to redistribute, unpack a little bit on 8th Street and move some beds to the North Campus near the airport over the next few years. Clinical volumes are significant. I think a basic point I'd want to emphasize is Shands is a superb trauma hospital, but it's also a first-class teaching hospital with superb services in virtually every specialty area and quaternary world-leading services in a number of areas, including cancer, neurosciences, cardiology, and others. It's a superb place. Just a map of the various sites in the region. Now, having heard all the doom and gloom about the finances, and it is dire, actually, the circumstances. It's unclear to me how this is going to sort out. I don't take it personally, but between the time that I accepted my position last fall and my arrival, the state decided to further cut rates for Medicare and threw us into some very difficult financial circumstances. it's temporally related to my arrival, but I don't believe that I was the causal factor in that. So. I think the University of Florida in Jacksonville, assuming we do manage to survive, could be the main driver, or certainly one of the main drivers in priorities for the region that have been articulated previously. That is to enhance bioscientific research in the region and to increase advanced clinical education, notably graduate medical education. These are both key parts of the University of Florida mission as well as the mission of Shands Jacksonville. I would propose that the city leadership formulate plans for at least one or more biomedical research parks. They exist in nearly every U.S. state, virtually every continent except Antarctica. Most major cities across the world. I'm not aware of a significant biomedical scientific park project in this metropolitan region, which is astounding given the size of the city. It's not at all radical. In fact, it's pretty conventional across the country and across the world. And in fact, across Florida, one of my favorite sources that I cite frequently here, Wikipedia, says that all these other cities have significant bioscientific parks. In fact, Orlando has 2. Why don't we get moving in this direction as a city? If implemented, we could have a substantial direct economic multiplier effect. We could have a lot of indirect entrepreneurial growth. I think it would attract and help retain young, intelligent, sophisticated scientific people who would add to the city substantially. I think it could stabilize downtown and help with development as well as other areas in the city, and a lot of commercial synergies. We do have long-term plans to help galvanize this on the main campus. We do need medical education and research building, and we're going to be talking to the legislature about some seed money, but I think it would, this is the sort of thing that I think could precipitate a substantial movement in the direction of bioscientific research based on this activity that we have with our 700 physicians and nurses on campus. We'd be happy to work with any higher education institution or hospital in the city to foster cross-institutional work. I think it would require key stakeholders to come together to say that this is a priority. It would have to draw investment from the state as well as from the institutions involved, corporations, and I think there's a key role for philanthropy to develop this. I think we need to get this ball rolling, and I certainly am working as hard as I can behind the scenes with the university leadership as well as our liaison to the state legislature, but would be eager to talk with others about how we could galvanize this project as quickly as possible. I have a goal in mind, as you can see here, and I'm going to get there. There are some barriers, but I'll figure out either how to jump this fence or go around it. So it will require, as I say, philanthropy. So there's a speed bump that my mother-in-law sent me. Wilson, bring me my wazoo. I hear I have money up it. So I'm looking around the room and I see a few people with wazoos, and I want to talk to you after this meeting. So thank you very much.
Well, thank you, Dr. Wilson. I neglected to mention that Dr. Wilson has a doctorate in anthropology and is a forensic psychiatrist. So he's rationalized that part about the budget reduction when you arrived, but you take it with equanimity.